Respected chairs, fellow presenters, and everyone present in this hall. On behalf of my research team, I'll be presenting on the topic Health Facilities Readiness to Implement Standard Precautions for IPC in Nepal. It's a secondary analysis of Nepal Facility Health Survey. So without further delay, I'll get to the context. So healthcare-associated infections are a major concern globally, and it incurs a significant economic burden and mortality rates, and this is more in the LMIC settings. Up to 70% of healthcare-associated infections can be prevented through effective infection prevention and control measures like hand hygiene and proper equipment sterilization. Despite the healthcare coverage expansion, quality of care hasn't improved proportionally, and few healthcare facilities globally meet the minimum IPC requirements. Implementing standard precautions, including IPC measures, is crucial for patient safety, healthcare-associated infections, and healthcare worker well-being. National IPC guidelines and implementation manuals, such as those launched by the Ministry of Health and Population in Nepal, plays a vital role in standardizing IPC practices and achieving the Sustainable Development Goal 3 for universal health and well-being. Now, moving to the objective of the study. The first objective of the study was to assess the readiness of health facilities to implement standard precautions for IPC in 8 service delivery domains. And as part of a note, I've listed the domains at the bottom of the slide. And objective number 2 is to determine association of readiness of health facilities to implement standard precautions for IPC with the characteristics of health facilities. Going to the methodology of the study, this study is, the study design of the study was secondary analysis of a National Health Facility Survey 2021 data. And moving to the variables, the dependent variable of the study is the readiness score to implement standard precautions for IPC. This was based on the Service Availability and Readiness Assessment Manual using 8 tracer items, and you can see the listed 8 tracer items. That is guidelines for standard precautions, latex gloves, soap and running water or alcohol-based hand rub, single-use disposable auto-disabled syringes, disinfectant, safe final disposable of sharps, safe final disposable of infectious waste, appropriate storage of infectious waste. And for the independent variable of this study, we looked at the location, the rural-urban category, ecological region, province, facility type, presence of external supervision, quality assurance activities, frequency of health facility meeting, and review of client's opinion. For the statistical analysis, we performed a weighted analysis to account for the complex survey design in our program. For the study, we applied a quantile regression analytical approach to evaluate the association between characteristics of health facilities and IPC readiness across scores with a set of quantiles ranging from 0.1 to 0.9. And the results were presented as beta coefficient and their 95% confidence interval. Now moving on to the results of the study. We'll be talking briefly about the characteristics of the health facilities. Majority of the health facilities were local health facilities, accounting for 90.8%, followed by private hospitals, 7.4%, and federal or provincial hospitals, 1.8%. So out of 1,565 health facilities, 52.3% of them were from hilly region, and then followed by Tarai region, accounting for 34.2%, and 13.4% from the mountain region. And from province, the health facilities were, the proportion of health facilities were majority from Bagmati province, accounting for 20.5%, and the least was from Karnali province, accounting for 8.2%. In terms of availability of services, In the federal or provincial hospitals, as you can see, majority of the health facilities have all these services, but child and adolescent vaccination services was the least, accounting for 73.2%. And in all health facilities, delivery and newborn care services was the least, accounting for 51.4%. Now, this table talks about the readiness score of health facilities for standard precaution for IPC. And you can see in all the health facilities, tuberculosis care area was the least with 55.5. That's the score. And the overall score of all health facilities was 59.8. In this visual representation, we see the distribution of IPC tracer items for different service delivery domains. And the guideline for IPC was the weakest domain, followed by medical waste disposable in each service delivery domain and each type of health facility. And latex gloves, disinfectants, soap and water, alcohol-based hand disinfectants were the most. So now this visual representation is a bit complex, and I'll try to explain the best way possible that I can. And I'm sorry if it's not too visible. So in this figure, the gray color that you see represents the confidence interval of beta coefficient from quantile regression. And the black dotted line that you see in the graph over there represents the beta coefficient from different quantiles. The red bold line represents beta coefficient from the linear regression results. And the red dotted line represents the 95% confidence interval from the linear regression result as well. So as per the result, we see that the readiness score of local health facilities was significantly lower than federal or provincial hospitals in all quantiles, ranging from 0.2 to 0.8. The facilities with quality assurance activities have higher readiness score at all quantiles between 0.3 and 0.7. The facilities with the mechanism of reviewing client's opinion have higher readiness score in quantiles ranging from 0.3 to 0.6. Now, this is my conclusion of my presentation. The readiness of health facilities to implement standard precautions for infection control was high, but leaves room for improvement. And this can be accounted for prioritizing allocation of human resource and also improving the health infrastructure. The health facilities performing quality assurance activities, health facilities with mechanism for reviewing client's opinion, and health facilities from Bagmati, Gandiki, and Karnali province had a higher readiness score to implement standard precaution for IPC. The results can support policymakers and stakeholders to make informed decisions to improve overall infection and prevention and control measures. This will enable the healthcare system to better respond to emerging health threats. Thank you very much.